Hello and welcome to my YouTube channel. Thanks for tuning in. I am Dr. Elham Raker, Dr. L for short, from Ask Dr. Mom, a telehealth, telecoaching virtual platform to help you get through all your baby questions. So today I wanted to talk about something that is pretty common, especially in younger kids, actually all kids, but more specifically geared towards younger kids, and that's baby rashes. So rashes are really common in the first year of life. It's just baby skin are a little bit more sensitive. We don't always know exactly why they happen. Most of the time they're not something to get too concerned about. And just a general rule is if it's not bothering your baby, it probably shouldn't bother you. And obviously if you notice something that's concerning, or if there's other symptoms associated with it, like fever, then you definitely need to talk to your doctor, or if it's just something that's just not going away at all and you're not sure what's going on. So those are all things to make sure you talk to your doctor about, and that is certainly something that I can help you with on a telemedicine platform. Rashes are something we can kind of take a look at on a video platform, so that's kind of cool. But today I just wanted to talk about more general things to do when you see a rash, and definitely things to prevent a rash, and more specifically around dryness, because I think that's something that sensitive skin babies are going to experience more so. And just a few things that I like to talk about with my new parents of things that they can do, and if it pops up, how to treat it, so that you don't have to call your pediatrician every time, and maybe this will kind of help prevent it from happening. So if you notice that your baby has dry spots, or just their skin just feels kind of dry, we're going to talk about just prevention first, right? Because ideally we just don't want these rashes to come up. So first of all, you want to make sure that you're not bathing your baby too often, especially as a newborn. They really don't need baths, at all. I mean, you really can just kind of clean the diaper area, maybe around the chin folds, under the arms, things like that, but they don't need bathing often. As they get older, you may want to give them a bath a little bit more, but again, not too frequently. And if it's a part of your routine to do it every night, like bathing babies to help them get ready for bed as a signal for bed, you don't have to use soap. You can just use like lukewarm water, so you're still going through the motions, but you're not using the soap every night. So that's number one, is to not really bathe them that often. Number two is the soap that you use. So you really want to use something that is, hypoallergenic, not, no fragrances, no parabens, no other artificial things in it. I know, unfortunately, that some companies are making efforts to remove all of this, but it's not always obvious that they don't have it. So you want to use soap from a trusted company. It doesn't have to be expensive soap. A lot of dermatologists even just recommend something like Dove. There's also brands like CeraVe or Eucerin that are very mild and don't have anything in it that should be irritating to the skin. So although we all love that baby smell, that's not always a good thing, and it could be drying out your baby's skin. So you want to use soap that is going to be more moisturizing and not drying. Then the third thing is, as far as prevention, is using a cream once, maybe twice a day, and you can use this as a part of your routine too, kind of like a baby massage, giving the baby a rub down before they go to bed. So the creams that I like to use, again, are something like CeraVe or Eucerin. You don't really want to use a lotion that's really water-based. And an ointment, which we are going to talk about, but not for this. An ointment is more for topical, treatment of little areas. So the cream is in between the two. It's a little bit thicker, but it can still be rubbed on relatively easily. So those are the things that I like to do for prevention and keep the skin just in good health. Now, if you notice the red spots, a lot of times they'll end up on the cheeks or on the thighs, or just different areas. Sometimes near the elbows, you'll notice these little red, dry spots. So at that point, you want to be a little bit more aggressive, because it's probably not going to go away with the things we just talked about. But you can use an ointment. So Vaseline is great. Again, it's cheap and easy, and one of the ones that dermatologists often recommend. No allergic type issues with it. It also can serve as a good barrier. So if it's in the diaper area, Vaseline can really protect as well. If it's really, really stubborn, and you can always, like I said, I'm happy to look at a rash, but you can also just do hydrocortisone over the counter. So there's hydrocortisone 1% ointment, and you can rub that on a certain area. If you haven't shown it to a physician, I probably wouldn't do it for more than a few days before showing it to a physician if it's not getting better, but you can do it 2 to 3 times a day, and over the counter is relatively safe. It's not high potency. And once the redness starts to go away a little bit, then you can stop using that and just keep going with the Vaseline. So that's the main thing, just more for the treatment side. And then of course you want to continue with the CeraVe and using the right soap and things of that nature. So, I remember having to do this with my daughter. She ended up having really sensitive skin and, eczema and other allergic stuff. But just a little tip for the older kids, for the toddlers, I had to distract her when I was trying to put on her cream. So we would talk about movies that we'd want to go see. We talk about amusement parks. We talk about, anything that I could keep her distracted. I would draw faces with the cream on her body. I would draw a happy face and then rub it in. So just, little tips if you have a toddler that's not so loving the idea of getting creamed all over. But that is some of my tips for dry skin, which I commonly see. And if you have any other questions, please reach out and let me know. Subscribe to this channel for more videos, and you can subscribe to my newsletter to get even more tips. Would love to hear from you. Let me know if you have any questions. Thanks. Bye.